Irwin. Thank you for joining us on this episode of Medwatch today. Fresno State professor Amanda McKeith had a cough that wouldn't go away for months. And it wasn't until she was referred to Community Medical Center's lung nodule program when she discovered she had stage 4 lung cancer. She shares how the fast action of her care team helped save her life. Visalia resident Amanda McKeith says she's had allergies for years living in the valley. So when she had a small cough for a couple of days, she didn't think much of it.
Well, I have seasonal allergies. So, and when I say seasonal allergies, 365 days a year. Have allergies, runny nose, itchy eyes, cough.
But after a month, her cough didn't go away. And one night, driving home from work, she was having trouble catching her breath, and she drove herself to urgent care instead.
They go, you have pneumonia, because I didn't have a fever. I didn't have, the only symptom I had was an elevated heart rate. And that was it.
She had a chest x-ray and was given medicine to treat the pneumonia, but 2 weeks later, she still wasn't finding any relief. Amanda saw her primary care doctor and had another CT scan that showed something on her lung. She was referred to a local lung specialist who told her she wouldn't be able to be seen for months.
You'll just have to wait. And I'm like, okay, like that's fine for you to say, but at the time I was 38 years old. I'm like, there's something wrong. If they're telling me I have lung cancer at 38, and I'm not a smoker, and like, yes, the air quality, but I'm like, there's something more here.
Not wanting to wait, Amanda called her physician and was referred to Community Medical Center's lung nodule program.
So she was seen in our lung nodule clinic, and as part of the initial intake, we do something called a triage, where if a CAT scan looks worrisome, they come in the same week or within a day or two.
Dr. Pravachan Hegde says after reviewing Amanda's scans, his team called her right away.
They got me in, and within a week I was in seeing their physicians and moved me very quickly through.
She underwent what's called a combined endoscopic staging through the esophagus and also through the lungs, where we use the ultrasound through natural orifices, and we biopsy the spots in the lung and the lymph nodes, which was done. She underwent the diagnosis and staging in the same setting, and within a week we got her diagnosis back, and we sent her genetic markers, which was positive.
At the age of 38, Amanda was diagnosed with stage 4 ALK-positive lung cancer, a rare type of mutation that was late stage and starting to spread to her spine.
I was shocked. I'm like, I'm 30, I'm not even gonna make it to my 40th birthday. So it was very life-changing. What do I do? We're at that point 2 weeks from the semester starting. I'm like, I have graduate students, I have classes I'm supposed to be teaching, I have research projects going on, and it all stopped.
Medical hematologist oncologist Omer Elias says a team of specialists at Community Cancer Institute met and decided that because of the ALK mutation, the best treatment option would be targeted therapy in the form of a pill.
The advantage of being on an oral therapy for your lung cancer is you can live your life very normally without making any drastic life changes.
And today, while she is not cancer-free, Amanda's cancer is stable, and she thanks the entire team at the Community Cancer Institute for being an advocate for her health and making sure she received the best treatment possible.
They wanted to make sure they had it correct. And that's really important to have doctors that are well advanced enough to know that, hey, we need to do these tests first because it's really going to determine our course of treatment.
I think for lung cancer patients, given the fact that they're undergoing such extreme circumstances with regards to the healthcare, any barrier that we can remove in that care is extremely beneficial for them. So the fact that it's a one-stop shop is what I like to call it. They can get their scans here, they can get their lab tests here, they can have their doctors. All of these kind of play into helping the patient have a very seamless experience at the cancer center with fewer barriers that they have to navigate.